So this is like, the return of the beloved son. I don't know that I can still introduce Ashish to you because Ashish is known to all of you, I think. I see some faces in the back where I don't know whether Ashish was in your classroom or whether you worked with him directly, but Ashish obviously was our Senior Associate Dean for Academic and Student Affairs. He is one of the national experts in the area of population informatics, an innovative thinker, and innovative academic, well published in the field of informatics, but also across the board in the application of information systems to public health education, using evidence-based in the academic world, and expanding the efficacy of public health education to all levels of education. One of the things that we found recently, as an example, in a study that we conducted on trust in science and its impact on adopting public health recommendations during COVID, was that people who trusted science were much more likely to be university educated and employed as such. And that shows a gap in terms of the importance of emphasizing science and health in our educational systems from a much, much earlier stage. So in that regard, our dear colleague, our dear senior colleague, who is now the Dean of Public Health at the University of Memphis, is applying his innovative approach to public health education, starting in the schools in a city with the highest level of diversity, in order to inspire students at a younger age to think of public health not just as a priority in their lives, but also potentially as a professional direction that they may take in their future. Today, Ashish is going to be talking to us as translating public health education into community impact, which is basically what all academia should be about at the end of the day. And his experiences in that regard transcend even the United States, with many of the innovation labs that he has created in India that have become the talk of innovators in India, very successful. I don't know if you're going to talk about this at all today, but is also another example where practice and impact is so significant as a modulator for change at the community and population level. Without more ado, I will introduce to you a colleague, a friend, a brother, a boss, a mentor, and a wonderful example of how the CUNY School of Public Health has been able to share genius from within the school and share it with the entire academic world. We know that every time that Ashish is able to achieve one more new thing at the University of Memphis, then a heartbeat at CUNY School of Public Health acknowledges, approves, and celebrates his success. So Ashish, the podium is yours. Do we speak into this microphone or into this microphone? Who is that microphone?
Thank you. Thank you, Dr. Ayman. Actually, good. Thank you so much, Dr. Ayman. Actually, it reminds me, I was telling all my dear colleagues, actually, it's feeling like coming back home. And it reminds me that I'm giving my faculty staff council update, actually. So I'm very used to staying here, but I don't have any words to express, but I just want to express my gratitude to be given an opportunity to be at this platform again. And that has actually nurtured me to be where I am today. So this has played a significant role of what I have learned and try to take those lessons which I've learned here and apply certain those lessons to making things further ahead in the direction where public health needs to be. I also want to acknowledge like everybody who's here, who I have had the opportunity to work with. It's such a pleasure to see you and to be with you all once again. I was debating like what the topic of my presentation is going to be, but I think I wanted to share some of my last 22 months of the work, what we've done at the School of Public Health. And everybody knows that I love acronyms. So SPH CARES is an acronym for the School of Public Health there. About myself, I don't know, but this is who I am. I want to have I'm a person who likes to create impact, live a life with a purpose, and believes that giving is a blessing. So this may not be a traditional accolades of what my education is, but this is very strongly, I believe in, this is what it drives who I am and what my work is. A little bit about my academic training. I'm a clinical clinician by training, learned internal medicine and moved to the US in 2002 to pursue my master's in public health, and then did a PhD in informatics. And the reason I always put this slide, even though many people know this, but when I came here, I hardly knew how to turn the computer internet on. That is my background. I was only a physician who was practicing patients, came here and learned that there's no barrier to any learning. There's no barrier to any learning. And that helped me to come up with a SMART model. And I'm going to talk about how I'm using this framework towards building now a School of Public Health at the University of Memphis. Sustainability is a very critical component. We live in an environment, whether it's higher education, whether it's public health, sustainability is key, multiple sectors. You can't improve health unless you improve non-health indicators. Accessible, you want to make information accessible, affordable. Reimbursable is a very important component because today, about 3.9 million kids are debating whether they need to go to the college or not for higher education. So there has to be value for education. And then lastly, tailored, like what works for me may not work for somebody else. What works for somebody else may not work for somebody. So this is a framework which I'm using, and I'll talk a little bit about that. The journey has been great. I started as a research assistant professor, educator, but I know that innovation and entrepreneurship, I've strongly believed is a great element. And Firefly Innovation is also one of the examples that Terry is doing out over here, is a great example that how important it is to have entrepreneurship out over here. This is a pillar which I'm using: inclusivity, diversity, equity, accessibility, and sustainability. I keep on using the word sustainability a lot because I think sustainability is a key element. And this has been one of the challenge for mistrust in the community when we do public health research specifically. Because we might go there, we conduct research, we publish, and people come back and how great the research is, but then how does it impact them at the grassroots level? So why public health is so more important than ever before? We are living in a very complex, changing social, political, cultural, and emotional and economic norms. Education is really going through a new way of reimagining, where emphasis needs to be on population health and social determinants of health. And I bring this up very importantly, especially at the University of Memphis also, because one of the areas is well-being of the students and the environment in which they live in. So if you're not feeling like well, you're not going to be academically doing good. So how do you really talk about not just health, but from the well-being aspect of the things? The second is changing student and workforce needs. COVID showed that the workforce has directly being impacted and not just fulfilling the new positions, but also the new jobs and the responsibilities and the tasks which need to be performed. We are living in a very resource crunch environment, so we need to be creative enough to identify new revenue streams. Globalization, I use the word globalization, like everything is global now. There's nothing word like local or global, everything is connected. And COVID was a very typical example of showing how interconnected the world is actually. We need to have solution-centric approaches, which is taking ideas to all its way to implementation and not just limiting to keeping it as an ideation stage. And lastly, creative leadership, which means coping, adaptability, resilient, and empathetic. There's a lot of pressure sometimes in administrative roles, and How do you cope in day-to-day things? How do you adapt and be resilient and empathetic? So this is why I feel that public health is so important based on the changing paradigm shift. Of course, we need more epidemiologists, we need all community health workers, we need social behavioral scientists, but basically we need to make sure that we are coping into the new realities we are living in. And that puts us into the bracket of public health 3.0. How do we really engage the multiple sectors and community partners to generate collective impact? And how do we measure impact from the lens of the community? This takes me to a second phase of like, how is this model trying to address the challenge of the higher education in public health, and then giving it an example of how it is being operationalized at the University of Memphis School of Public Health. I'm not going to talk too much about this parameters, but this is where it is. It has to be data-driven because we are living in a world of narratives, and narratives are not sometimes driven by data. So we are living in a world of misinformation, disinformation, so many other things. So how do we really create a data-driven decision-making? And the data cannot be just generated from one source, but from multiple sources. So how do we make sure that all the sources are being well thought through? Now, in the informatics terminology, we always say that there's a difference between data and information. We're sitting on millions and millions and millions of gigabytes, terabytes of data. But are we using that in the right way to generate meaningful information? And then how do we improve that knowledge and policy making using those parameters? So SMART, it's a human-centric approach, which means the user is at the center of everything. And the user could be anybody. It could be a policymaker, it could be a practitioner, it could be an individual, it could be a clinician, it could be the juvenile court system, it could be anybody. It allows for data-driven to be generated from multiple places into one platform. Dynamic and flexible approach because we cannot be rigid with our solutions. We have to be nimble enough that they're agile enough to be adaptive to the changing world. And then help solve real problems with real solutions. And that's why I call this a middle-out approach. It's an interface between top-down and a bottom-up combination. This is the hub which is taking, like, there are 5 parameters, and these are the 5 parameters which I'm using to really, from the lens of how to operationalize the real impact in public health. It has to be community-led, which means the community should feel the impact of the education programs. Research-based solutions, I don't use the word research, but I use the word research-based solutions, which means solutions need to be translated into practice back. Interventions and innovations, sometimes innovative idea could be very risk-prone idea, but you still have to be innovative. Skills-based education, which means that not only waiting for the competencies to get update every 3 years, 5 years, but also to look at the dynamic job market, which is actually creating new workforce. And entrepreneurship and employment is a very critical component. I can tell you, like, from the industry, like, there's a Ford plant which is coming at Memphis. And one of the things they said, we want people to graduate quick. We have 5,000 jobs, we want people to be coming out quick. Get the skill, get into the job market. So those are the needs of our prospective employers. So we also need to make sure what our employer needs are. So the way it's, how do you really operationalize? It's great to have a model, but how do you really operationalize? You identify communities. Communities could be anything. A school of public health is a community. A community could be a neighborhood. It could be a hospital. So I will give an example of how School of Public Health is to me a community, and I'm using this to apply towards that. You identify who your change agents are. You would like to work with people who are your early adopters to your thought process. You bring them into the model. You gain insight of what's available, what's not available, what's a gap. So you do some kind of time investment into understanding the needs of the community. It's very, very important to reflect upon the data. Like, we need to show everything through the lens of the data, because data can be very powerful and sometimes a little bit underestimated. And then visit the people back into the communities to show that you are really making a change. And this has been the model which has been across multiple dimensions, whether it's income, equality, education, employment, and other parameters. The model has been applicable across multiple dimensions. And for these are the several SDG goals which this model has been applied across different countries. And how do you take this to the City of Memphis. It's 22 August 1st when I joined there. And one of the things was to really understand the length and the landscape of the city. We have about 1 million people sitting in the Shelby County area, which has about 7 cities, 54% African-American population. Some kind of college here means not necessarily that they have completed college, but they have started the college. Unemployment is about 4.5%. What really struck is children in poverty, which is 24% children in poverty. We are dealing here with children with single parent household is about 44%. If you look at the sexually transmitted infections, that's about 1,000 per 100,000 people in the Shelby County. And if you look at teen births, that's 31 per 1,000 compared to almost 17 in the US. If you look at the disconnected youth, that's about 11% of teens and young adults face. They were neither working nor in school, they just feel disconnected. So this is to me a problem. And how do you really solve this problem? By being in the School of Public Health. Because that's basically what's leading, whether it's diabetes, whether it's hypertension, whether it's road traffic accidents, whether it's homicides, gun violence, crime, you name it. Shelby County is one of the most worst counties in the state of Tennessee, as well as worse fare than the average counties in the nation, both in terms of its health factors, as well as in terms of its health outcomes. So that means there's a lot of room for improvement over there. And if you look at this, this is where we introduce the SPH CARES. The CARES means we need to be a community engaged school of public health. Anchor means we are grounded in the communities. And there's a federal definition of what an anchor institute is. And R is research-based solutions. Like how do we, what we find, we ultimately implement as a program in the community. Can we take some entrepreneurial and innovative ways, and why student-centered is so critical? And this is a vision towards building an impactful school of public health. This is what our school had, like current state. I'm not going to go what it was, but it's great to have this opportunity that we had about 16 faculty, or about 18 more faculty will be there, so 34 faculty. The school has grown from $1 million to about $15 million. And most important is that we are engaging with about 200 community-based organizations in the city. These are some of the programs. And that led to this approach of how do we tell community that we are community engaged actually? So I'm going to take these 5 buckets and give examples of each one of them. The framework, I like framework just to give, that gives a sense of how we are operating in terms of that. The goal was to become a knowledge hub for communities. Grounded in communities means that you not are just hiring people locally, but you are actually establishing your physical facilities within the community's hubs itself. For example, having a public health facility in the neighborhood community center itself. Research-based solutions to drive community needs, and prepare a workforce that is not just aimed to attain degrees, but are engines of knowledge economy. And the reason this became very critical component because of the budget cuts which were happening in the city of Memphis County. But at the same time, the Federal Reserve was very interested to see if there is a way to create as a knowledge economy. How does that drive change? And this is how I approach it. To me, these are the 5 stakeholders. Students are the most important element. Faculty staff was there. Within University of Memphis partnerships, health department and other government agencies, and then the community-based organizations. So this is how it was getting operationalized. Okay, these are the different players we need to work with. So at this point, the first thing which I know that I spoke to Dr. Ayman about this when I was initiating, and I have to say that the president of the university and the provost were very, very supportive. And I went and said, we want to start public health at the high school level. Now, it's not going to be easy sellout. It was tough. But this was something I am very happy to say, like, this was something like no negotiator, like this is what I would like to do. And they said, what resources are needed? No, I don't need any resources. We have assistant professor teaching, we have doctoral students, advanced training, we have master students, and we just need to introduce this. Like you have other program, people go for health sciences, but health sciences is not the need. The public health is a way to go for. So we just did not go and just get the program, but a very comprehensive analysis was done on jobs only with students who graduate with bachelor's degree for the first time. And it was very interesting to find some of the results that actually helped us to create this model. Take it, connect to all over the place. So right now there's a public health dual enrollment program, and we took the advantage, the state just approved that 30 credits can be for free for any student who can earn X that number of credits while they're in the high school. And we wanted to leverage that into public health concept. So dual enrollment is public health. So if a student or a child or a young kid in junior year can do public health in the United States, of course, somebody from Australia can do it, from Nigeria can do it, from Uganda can do it. So I was able to persuade the leadership to get the first interdisciplinary high school public health certificate at a global level. And as a part of that, students can come for 2 weeks as a study abroad program to the University of Memphis now. So which means students in junior and senior 11th and 12th grade actually can come and take the undergraduate certificate. The third was Reim Public Health Ideas Hackathon. Hackathon was really to create a community of high schoolers to solve public health problems. But the requirement was that they have to propose solutions that they will be able to execute back into the community. It cannot be an idea which will be in the room, but the idea that they will have to take back into the community and apply that. And that was that hackathon could be a one-time thing. So people might do it just for fun, but really not for the continuity. So we established public health clubs in all the high schools. So right now, like almost in that about 40 high schools in Memphis, Shelby County area. So there are 10 high schools we have now our public health clubs established, which means every week there are public health ambassadors which go there on Monday, Tuesday, Wednesday, Thursday, Friday, teach them and train them on public health. So this has led 10 schools. Fortunately, we got the grant from CDC. I'll show you that. It's a grant which is now allowing us to take it to the primary level. So we changed the entire curriculum, but there was all prereqs removed in this courses, nothing. They can learn public health, global health, number one course, doesn't matter. You don't need to be a statistician to learn that. You need to be aware on population health, social determinants. So these are the 6 courses. One of them is a gen ed course, general education, that they learn during the junior and senior year of the high school now. So 55 students participated. We have 3 schools as a pilot, which has now expanded. And very, very interesting is that the students thought that they can become nurses and doctors. They did not realize that public health is an area for them to go. So at least what you're doing is you're sensitizing the young population about the field of public health and giving them different avenues that they want to choose. Environmental health sciences, go for it. You want to go in the world of data science, go for it. Analytics, great. Global health, but you are really creating this. So this has gained a lot of traction in terms of the high school in public health. We started our hackathon. It started as a very simple concept from one school. It is expanding to now about 9 countries. Where students, only high schoolers, they all do collaborative pilot projects to come up with solutions. And some of the areas which came out was access to healthy food. So one of the students proposed how healthy food is a challenge in Nigeria versus a healthy food is a challenge in Memphis. How it is a problem in Portugal versus Malta. So we have now about several countries participating in our second. The second hackathon was on misinformation. That is a very, very powerful platform. The results are coming out of that, which are very, very interesting to see that. The clubs, they are built on these 4 pillars. So basically, resilience public health curriculum is what is being introduced to these students. Memphis Shelby County Schools, this program would not have been successful without the support of them, because they really you had to buy in to get all the school systems to get into this thing. This led to our first center grant with the Shelby County Health Department. And it was one of the largest grant, second largest in the history of University of Memphis system. about $13 million that will address 3 key areas of public health workforce, data foundational capabilities, and data modernization. And built on that, what it did, it created 18 public health employees at the health department to pursue their PhDs and masters in the School of Public Health. This is a framework. This is the slide which was presented, I think, by Dr. Taylor at the CDC at Atlanta yesterday to the CDC director, that we've almost linked everything from the elementary school to all the way to the community now. So, and all this is grant funded work from the CDC now. So connecting the elementary school to middle school, middle to high, high to undergraduate, graduate, and all the way to the community lens, which means that the students basically, when they are in grade second, third, can do experiential learning in public health. They move into middle school, they get into public health clubs. In the high school, they do practice of the course. Then they go into the graduate program. And then ultimately we are engaging them into the community. So this is kind of a real framework of a loop from all the way to the child. Because remember the disconnected youth, teen pregnancies. So you're actually addressing all those parameters because you're starting it very early in their career now and the life. These are our 18 scholars. Several of them are now pursuing their PhDs. And these are people who are coming from finance background. They're coming from management. They had no public health backgrounds. So the whole goal is to really sensitize them. So one of the things which was very interesting was that the person who was the finance director said, now I recognize the importance of processing the contracts rightly and timely because they all impact public health. So I think that's a kind of impact which you can have when you have people trained into public health that way. We got the second, this is a very big grant. It's a 8 states collaboration with Environmental Justice Center. This is the only school now in the state of Tennessee, which has an environmental justice center. We're focusing on how to build community capacity in writing grants, technical assistance, and workforce development for the next 5 years. This is an example of community partnerships and collaborations. What really mean is with the health department, we established a center. With the Shelby County School System, we started the high school. I'm very, very excited, waiting to see the results. I wish the results were now, like I would have shared this today, but we are working very closely with the juvenile and the criminal court system right now to look at juvenile justice from the lens of public health. And in the veteran affairs, the new Center for Excellence in Veterans Health is coming at the school. And then neighborhood and community centers, we have public health in action, experiential learning, basically, which means our students are actually going to those community centers as a part of a voluntary scholarship program. So they have to go. So they've adopted 75 community-based organizations as a part of that initiative. The impact is, even though I can measure this impact, but I wanted to highlight that community partnership that's what leading to research. That's why the first slide was this one. Then that led us to the research element of increasing our research to 400%. We've created a model for high school education, gone into student-centeredness, Office of Recruitment, Admissions, Enrollment, Assessment, and Practicum. So I like we are trying to reap through these offices the concept of leaping the leadership in public health. And this is a network which is getting established. So obviously this has come a long way. But obviously the team and the support from the staff, the faculty, and the university leadership has been great. But community engagement has been fantastic. Community partners, especially the health department director, Dr. Michelle Taylor, has been absolutely instrumental in supporting this. And with this, we actually were recipient of the Hyson C. Spencer Award in 2024, actually. That helped us to be there. This is the whole team. And any questions out there? But I just wanted to share a brief of what has been so far there going on.
Until I get the question that we have on chat, I'm going to ask you a very realistic question. Obviously, the education system and the public health system in terms of departments of health and so on are really independent of each other in terms of the funding model. Uh, Many of the states around the country are experiencing, as you mentioned, cuts in the funding of their departments of health. Even the Department of Health in New York City, which is one of the largest, if not the largest in the country, with $2 billion in annual funding, has experienced funding cuts. We have a lot of unfilled positions in the Department of Health here in New York City because they don't have the funding to fill these positions. So I was going to ask you about your graduates, both undergraduate and graduate level. Where are they finding jobs, and how are you're talking about the workforce and our ambition as educators to enrich, renovate, enhance the workforce in public health, but sometimes we find that our hands are tied because we really don't create these jobs, and we're looking at shrinkage in job opportunities, at least in the last couple of years. So can you tell us more about job creation, or about, in fact, what is happening with your graduates?
So thank you so much, Dr. Ayman. I think many of the positions are being employed by the health and the hospitals because Memphis is a medical district. It has St. Jude as a headquarters, Methodist. So a lot of positions are there. Very importantly is that the way we are positioning the School of Public Health is that it's an economic aspect on the city. So there's a lot of avenue, like FedEx headquarters is there, International Paper. Now, International Paper has its first public health division set up now. It never was there before COVID. Nobody could even think that International Paper is going to have a public health unit. So the third component is obviously not just the Shelby County Health Department, but the Tennessee Department of Health has a lot of workforce. Most of these jobs are also in the rural areas of Tennessee. Those are completely untapped like positions. And one of the incentive of this program was not just to fill the new positions, but to maintain retention. Because retention is becoming a much bigger problem because people feel that they are not getting enough salaries. The third thing which we are doing is, I don't know if this is going to be possible or not, but at least the effort is by investing in the current workforce, is there an ROI to the city and the county at large that we can push the county somehow to say that this could be an important component of the budget of the county itself? So somehow to incorporate that as a part of the process in itself.
Well, that's a very interesting approach to convincing the city and the city government that investing in public health positions will actually have a return on investment that is calculable from an economic point of view. That's a big job, but requires an economist working with you hand in glove, I guess. Okay, thank you. There was a question on our chat. Paolo, would you like to read the question, please?
Sure, thank you. The question is, in reference to the hackathon, what prizes were offered? Who were the hackathon sponsors and judges?
So the hackathon was sponsored by the School of Public Health. The judges were all the people around the world. Actually, we have a hackathon global scholars group. This is a representation of 9 people from around the world. And we have representation from CDC. We have representation from the UK Health Security Agency. We have representation from Canadian government, Australia. So the hackathon was not including anybody from the school. We were not having anybody from the school. It was all out. The award which was given was, that's an interesting one. We gave a small, like a plaque, which was actually not, it was a creative plaque, which reflected why public health is important to them at this stage. Their name engraved in that. I don't know the cost of that, what was it, but the goal was that it allowed independent reviewers to look of the ideas. And the one advantage of this was by bringing external people from different parts of the world was that it also helped us to really penetrate and permeate through different other countries to come to the hackathon.
Can you give us an example of the winners of this hackathon?
Yeah, like
it's a very exciting idea.
It's a 9th grade student talking about the issue of social isolation post-COVID.
Say again.
A ninth grade student talking about how he perceived the social isolation after COVID.
I see.
Just one example. Second, why don't we just, if we know that litter is a problem in Memphis, then why don't we solve it? So one of the ideas actually came was that there should be a public health club interaction done. And so in the fall, we are hoping to do a major public health summit in the city of Memphis, hopefully, if everything goes well, where all these students will be brought together to pitch the ideas on how they can solve the issues within the city itself.
It's very exciting that you mentioned that. I remember in 1987, community groups in Pune, in Maharashtra, came together to solve the littering problem in Pune. So there are probably examples where community-based grassroots efforts helped solve the issue of littering around the world. So it would be really fascinating to see how these solutions are going to sprout in Memphis, Tennessee. Other questions from the audience?
Hi, good evening. Thank you so much. This was so exciting. I was a little late, but in the research I was doing online, I just want to start with like, thank you. Thank you in many levels, because for people who are, I'm entrepreneur, public health entrepreneur, innovators, always trying to create new digital products to support public health in middle school, elementary school level. And I just don't get to experience people this passionate, and bringing maternity global is just, I'm grateful, you know, especially because I work in communities that I grew up in. I grew up in the Bronx in the 80s. So I didn't even have trees. You know, I literally did not grow up and see a tree unless you went to a park. So this is so exciting that we are here in 2024. So I want to ask the question is this: as an innovator, I'm an educator, what advice do you have? Because like, as myself, I don't have a lot of the connections to people. I don't know anybody in the CDC. I don't have colleagues who do. And how do we, even though I'm on that level, I'm not on the ground level because I have about 8 years of case studies that I've conducted in schools, but getting funding is not that simple. And and once you've done it for 5 years, your partner wants to divorce you and stuff, you know? And so I'm just making a joke because I'm nervous, but I'm at a level where I know that it's time and we're ready, and we have the interns and we have the connections and we have the other. What advice would you give us who is deciding to bring public health at an elementary and middle school level and start here in the city where we're from? To who do we pitch to, you know? Where do we go, you know, besides events like this? So that's my big, giant question. Thank you.
I'm actually glad that you asked this question, because the answer is very simple. You don't have to pitch to anybody but to yourself. Okay? You need to go out, find a school, and just do it. Don't wait for others to come and rally behind you.
Like this.
So let me tell you, we didn't get the money to do the work. We did the work and then showed that this can work. So do what is in your hand. Even if the funds would not come, still we are going to do this, because think, we have, let's say, we are giving 15 scholarships to our students. The scholarship in the fall recognizes that the students will have to work with 3 community-based organizations every month. So if you're 15, you got like multiply by 45. So you have people, so you don't need to get the resources unless you start to prove it. So I'm not going to say everything is perfect, but I'm just saying that you will have to take the charge yourself, get to meet the teachers. And I will say that there are people in Memphis Shelby County school systems who like that. They need to take ownership of all this.
Yeah.
That's how I will respond to that.
I think this is a good response, and I would like to know how we can assist you. We have 800 graduate students in public health. The major issue that I was really admiring about what Ashish did was create a curriculum that is applicable to schools. Because if we go to them and ask them to develop the curricula, it's difficult. Yeah.
We did the curriculums, we have the case studies, and now the next step to, I obviously, I know in here signed an NDA, so the next level we want to go to in technology, we need funding to do that. So I'm sure we can't.
So I don't know if you know, but yeah, I will just say, I don't know if you know, but CDC just said informatics is the most critical element that they have plugged in. It's 2 weeks ago. So it's not about, I have to emphasize, it's not about just getting the resources sometimes. You have to just go out. I know you might have the curriculum, like let's say, demonstrate like how many students have taken, what the impact has been. So that way it can help out. Oh, sorry, Laura.
Oh, it's okay. Hi, Ashish. Thank you for this great presentation. It was really inspiring. This may be a product of me not having my glasses and missing it on your final slide. But I'm wondering if you're already seeing enrollment numbers increase in your undergraduate programs from the students who have taken the curriculum in their junior and senior year.
Yep, we actually, it's just, I didn't put a lot of stuff out over there, but we are having 16% increase in a domestic enrollment. And that's all happening because of we are right there in the school systems. You know, what's happening is you keep on telling, you don't want everybody also to come to public health. Remember, the goal is not that everybody comes into public health, but the goal is that people understand the importance of public health. So that way, it's not like we don't have enough jobs, so you don't want to just put everybody, but if they are doing understanding at that point, they can communicate those things to themselves for their well-being. They can communicate to the families in which they are living, and then that families can take it back into the communities where they are. So the goal, we have 16% increase in our domestic enrollment. I would actually say that public health dual enrollment to me personally, there are about 17,000 approximately students in high schools. Approximately that much. And 12,000 are in about grade 11th and 12th. So even if you have 10% people getting trained as public health ambassadors in the city of Memphis, which is 1,000, I think that will help them to bring a lot of understanding about the change within the city itself. Yeah.
Other questions on the chat or in the audience?
Right here.
Yes.
Hi, I'm wondering if you've selected any metrics that you're targeting for the penetration of all of the interventions and education that you set up. You know, you put up some demographics about the community. Are you looking to shift some of those? Like what are the performance measures that you're measuring?
Very good question. So there are 5 broad parameters we are looking at. One is school absenceism, dropout. We are looking at, there's a metrics on anger management. We're specifically looking at that because we are looking at the really root cause things out over there. How people perceive the importance of hygiene. How do they value education? And how do they perceive what is being healthy food and those. So there are actually baseline assessment, like if depending on which age groups, how many have gone through the screening for certain STA conditions or other things. So there are both objective as well as qualitative measures in place to reflect upon the change of the impact of the programs.
Yes, we have an additional question from the chat. To build off Dean Elmohandis's initial question, given Memphis Shelby County's location, is your work also reaching into the metropolitan area across the across the state lines in Mississippi and Arkansas? These states have significant public health disparities that you are working diligently to address.
Very good question. So the largest county in Mississippi is the DeSoto County. So we are just having a discussion with the superintendent school systems there. And if everything goes well, then we should be able to take this program to the state of Mississippi very soon.
Thank you.
So we don't share any borders with Memphis, but it would be very interesting to apply your program based on your enthusiastic response to have a Harlem-Memphis kind of sisterhood or brotherhood or maybe a Bronx, Harlem, Memphis brotherhood or sisterhood. I mean, you've started something really very innovative, and I'm not at all surprised. I expect that of you, but I think you are very generous in saying that you learned things working here in New York. I think it's time for us to learn something from what you are doing in Memphis as well. So with the enthusiasm that I hear, keep the connection going, and maybe we can also get some money from the CDC. Our students have to do a practicum in the community. And so this could be an idea for something that they can do. The idea of public health oriented clubs in high schools, in Harlem or in the Bronx I'm sorry? Or both, yeah. Instilling curricula, especially in high school, discussing issues of chronic illness, intimacy and safe intimacy, social interactions, and so on, are all issues that could be very valuable. We have here a community advocate and a leader in her own rights. So we may have a moment here where you may regret having come to visit with us here in New York.
Not at all.
Because we're not going to leave this idea alone.
Not at all.
Other questions from the audience or on the website? Yes, we have Adam. There you go.
Sorry, me again. You pushed sustainability quite a few times, and I know the CDC grant helped you guys kind of balloon this into what it's become for this presentation. But resources, like this woman in front of me was saying, is a huge issue. You also had one of your R acronyms was reimbursable, and I'm wondering, if any of this can be tied into some of the work that New York is doing to kind of bridge the divide between social determinants of health and community-based organizations who manage them on a kind of charity grant, very unsustainable basis, and integrating that into health services that are reimbursable. We have the 1115 waiver coming out here in New York, and it's an infusion of almost $7 billion to make this a reality over the next couple of years, where community-based organizations who are always searching for resources and funding can, if they qualify, be brought into the fold so that these things just become a part of our normal healthcare reimbursement system. And it would be great to be able to kind of integrate the public health infrastructure you're talking about with the healthcare infrastructure that needs it, and see if there's any alignment there. And I wonder if there's been any thought to that.
So I'll just say that the advantage of working with the Shelby County Health Department and having this center, the goal becomes that it gets institutionalized. So we are not thinking from the lens of just grants. So that is why it's a very systems approach of like working on different levels to show, listen, like for example, if I just tell you dual enrollment, we are not spending anything, right? The state is already paying for it. So we are leveraging the existing resources in such a way that creates a pipeline. And this pipeline is trained enough to support a lot of community-based organizations and build the essential capacity that will allow them not to just go to one agency for a grant. There are a lot of fundings out there. For example, National Institute of Justice, the US Department of Justice has a lot of grants right now. As a matter of fact, you can't apply a grant as an academic institute. You have to have a community partner who is a fiscal agent now. So I think institutionalization of these resources is where they should be actually. The centers can be good to be in academia, but they actually need to be somehow institutionalized in the health department. That means it can be a part of the budget on an ongoing basis. Otherwise, sustainability becomes a question.
Well, yes, Adam, you have a question.
Hello, my friend. I haven't been to Memphis in a long time. Thank you. I haven't been to Memphis in a long time, but I know it was a city that was disproportionately impacted by the Great Recession, and it really destroyed the city's economy considerably. I don't know how well the city's bounced back since then. It's been probably a decade since I've been there, but I'm curious from your perch, leading the School of Public Health, how you talked about lifting up the city and bringing folks together, and beyond the Department of Health and the partnerships that you've established, how are you trying, and how are you going about bringing together industry leaders, government leaders, nonprofit leaders to come together and acquiesce around this idea that public health could be at the core of lifting up the city economically?
Yeah. So thank you, Adam, for this question. So we, for example, I'll tell you, we just submitted a grant with TCAT, which are called Tennessee College of Applied Technologies. And in this grant, the requirement was to work with the chamber and the Workforce Economic Forum. Not even that, but also the Federal Reserve Bank, actually, of St. Louis. So we've been trying to incorporate all those individuals as a part of our advisory board, but they are actually coming to almost all our grant rounds. So it's an effort, a lot. But I feel that one of the uniqueness in Memphis is that people are very much ready for the change. So I think it's a question of that silos is not going to work. Everybody will have to work together, but the goal is going to be what that together look like. So I think the School of Public Health can be that neutral, convening avenue that could actually facilitate that collaboration. So to respond to that is that basically what we've done is we've opened all the doors now. That anybody and everybody can come into the School of Public Health. Even the meetings which the DA does or the criminal court judges are doing, they're doing at the School of Public Health now. So the more they keep on coming, the more they will see the value of public health.
So a model where the university becomes an agent for economic development, which is an interesting model that CUNY also relies on, as we say that we are a model for social transformation and economic development. So any more questions? With this, please join me in thanking Ashish again for coming back and in this opportunity for learning. And as I said, my bringing him here to New York again was not just by coincidence, but hopefully so that we are anchored with him, as he said, anchored, and we move forwards together. It is time for you to teach us something that we need to learn. So thank you so much, Ashish.